The golden years, a time to slow life's hectic pace, to stop and smell the roses, a time to embrace life and all its blessings. These years can be as productive as years past, though age does deliver some limitations. We all know we don't have the same vim and vigor we did as teenagers. Aging takes its toll on our skin, our bones and muscles. We feel the years in our lungs and other vital organs. Our cardiovascular and immune systems become less efficient. So does our nervous system and intestinal tract. We lose hearing and sight, sometimes even our senses of taste and smell. The list goes on. But Alzheimer's disease is not on that list. It's not a normal part of aging, although the numbers are high. 10% of us will eventually suffer from Alzheimer's disease. By our mid-80s, we have a 25% risk of developing the disease. The risk is even higher if a family member has it. Sometimes Alzheimer's is inherited. It is also incurable and is always fatal. Alzheimer's is part of a group of disorders called dementia.
Dementia is the inability to reason and to do those things that we consider part of everyday living, such as writing checks, reading a book, watching television, remembering things.
Dr. George Glenner is one of the world's foremost Alzheimer's researchers. He operates a brain bank and research center at the University of California in San Diego, sharing his findings with other researchers around the world. He says this group of memory disorders called dementia is broken down into two separate categories, primary and secondary dementia.
What they call the secondary dementias are those that are treatable and curable. And those are the ones that the physician wants to eliminate first, because obviously if he can treat and cure something, that's the end of the dementia.
There are more than 100 known causes for secondary dementia. The most common, vitamin B12 deficiency, reaction to medications, benign brain tumors, depression, or other mental health problems. Then there's the primary form of dementia.
62% of all cases of primary dementia are Alzheimer's disease.
The cause of Alzheimer's disease is still unknown, but the effect is certain memory loss.
And it's a very special kind of memory loss. It's recent memory that's lost. And the individuals cannot remember from 1 minute to the next what has happened to them. It is also a lot of confusion related to their disease and a lot of anxiety.
Anxiety over memory loss and the loss of cognitive abilities,
which are the ones to do with reasoning and having to write your checks and to be able to talk, be able to play the piano and whatever, or the loss of these would represent loss of cognitive abilities.
What is Alzheimer's disease? It all begins with a protein manufactured by the body, the beta-amyloid protein precursor, discovered by Dr. Glenner in 1984. This protein makes a devastating journey through the brain. First, the protein forms into silk fibers inside the walls of the brain's blood vessels. The vessel walls become so engorged with these silk fibers, they leak, allowing the beta-amyloid protein precursor to invade the brain's gray matter, forming plaques. The protein then attaches itself to nerve cells, causing them to form tangles. These plaques and tangles progressively destroy the brain, It actually shrinks or atrophies, destroying gray matter where cognitive functions originate. This is Alzheimer's disease. It's one thing to analyze a computer model, quite another to step into the lives of people affected by Alzheimer's disease. John and Lillian have been married 42 years, raised 3 children, and were making plans for their retirement when Lillian began to exhibit symptoms of Alzheimer's disease.
At first, it was a memory problem, and I began to suspect that there was something other than just, old age kind of thing. The other thing that crept up on us during this period was that you could see the anxiety when I left for work. She'd be alone all day.
3 years ago, John took early retirement so that Lillian wouldn't be alone.
She had the anxiety, didn't want to be out of my sight, where she hid things around the house, where she dressed inappropriately, would put on 2 or 3 blouses and a couple of pair of slacks, and I had trouble finding their clothes, and then the behavior, and over time, where she would begin to challenge who I was. When that day arrived, when she said that I wasn't her husband, that was probably the hardest day that I had. And she's lost all the memories that have made up our married life. Those things go. You can't refer to anything. You have no communication at all. And of course, that's another thing that's happened as the disease has progressed. Her communication has stopped. I live in an environment where it's really designed to keep her comfortable.
An environment filled with heartache.
That heartache is there just about every day. Because every day you're reminded that she's no longer the person she was.
There's no telling how long Lillian will survive. A patient can linger up to 20 years with Alzheimer's disease. In that respect, each case is different, but the disease will run its course in 3 distinct stages. As we mentioned before, the first stage of Alzheimer's disease is marked by memory loss, a loss of cognitive ability, increased anxiety, and confusion. In the second stage of Alzheimer's disease, these symptoms become more extreme.
To the point where the person becomes unable to communicate, unable to write, unable to verbalize in any way, has difficulty in understanding commands, and actually difficulty in placing their feet in a walking position. In other words, what we normally take for granted.
The Alzheimer's patient will lose the ability to move about on their own. They need to be bent to sit in a chair, guided to walk.
Because they forget, that's right. They just don't remember how to do these what would be normal things.
Then comes the third and final stage of Alzheimer's disease.
They can't talk, they can't point, they can't recognize individuals. They also have a very difficult time swallowing. And this is very, very important in the sense of what's going to happen to them.
They lose their ability to swallow and eat, and when they do attempt a meal, they often inhale food and liquid, causing what's called aspiration pneumonia, one of the most common causes of death for the Alzheimer's patient. A grim prognosis for patients like Lillian and for loved ones who care for them. But it is possible to plan a therapeutic program of care for each patient.
Stella, I'd like you to help me with some questions today. And if we're going to fill out a questionnaire, I guess the first thing we better do is put the date on it. Do you remember what year it is?
No, because I don't pay no attention to the years.
Meet Stella, an Alzheimer's patient who spends her days at the George Glenner Alzheimer's Family Center in San Diego, a daycare center for Alzheimer's patients. Hello. Manager Jerry Strachan compiles an assessment of each patient at the center.
Okay, I want you to read what this says, Stella, and then do it. It's going to give you a direction, okay?
What? Close your eyes.
Okay. Yeah, excellent.
The purpose of the assessment is so that we can get a baseline of their abilities, so that as we work with them and the disease progresses, we have some idea of how fast it's progressing, what areas they're losing abilities in. And by having a good baseline when they first enter the program, we can then determine what their losses are and to be able to help them by adapting the environment, by adapting our approaches to them.
The assessment includes a report from Stella's physician, her medical and social history, along with the results of interviews and questionnaires.
You know, I'm going to mention 3 words. They don't mean anything together, Stella, but I want you to try and remember them for a few minutes. And the words are apple, table, and penny. Can you remember now the 3 words that I asked you to before?
Oh gosh. It's left my mind. It's apple, one of them, ain't it?
Very good. And then what were you going to give me for the apple?
Kick in the rear.
No. How about a penny?
A penny.
Okay, and we're going to put the apple on the
Table.
Okay.
Strachan says it's important to update assessments.
We do the follow-up usually every 6 months, but also we can do them if we see a big change for some reason. Big changes can be brought on by physical illnesses. It can be brought on by a sudden deterioration of the mental abilities. And it can also be brought on by emotional crises, such as losing a spouse or a family member.
And no assessment is complete without including information from family members.
Okay. What about wandering? Does she ever wander away from the house?
Will not really walk away any place by herself, really.
And when you take these in combination with several of the other tools that we do, we can make care plans and we can make plans for the day that will help these people to recognize their environment and who they are, and also jog their memory and work on particularly past memory sorts of things.
The way she reacts in public.
That care plan is essential to the quality of life for Alzheimer's patients and their families, to determine the patient's true disabilities, to recognize what abilities remain, for planning their daily activities, and to keep them functioning at the highest level possible. In the past several minutes, we've talked about normal aging, the way years take their toll, how Alzheimer's disease is not a part of normal aging, but a disease that destroys memory and a person's ability to function. We've looked at the 3 distinct stages of Alzheimer's disease. The first with signs of memory loss and anxiety. The second, the loss of ability to move about without assistance. The third, with its complete debilitation and death. We've explored what's known about Alzheimer's disease, how it creates silk fibers called tangles that destroy the brain's gray matter, how it spreads throughout the brain, that research has yet to find a cause for this disease or a cure. We've looked at the importance of assessing the Alzheimer's patient and their abilities in order to design a program of treatment to limit a patient's disabilities. And in part 2 of this video training series, we will look closely at these treatment programs, how to design them, how to make them work, and why they are so very important to Alzheimer's patients and family caregivers.